Plastic operation of penis for straightening of chordee, e.g., hypospadias, with or without mobilization of urethra. The physician corrects and repairs chordee, which is the abnormal curvature of the penis. To assist in planning the surgery, an artificial erection may be produced by placing a band around the base of the penis and injecting saline into the body of the penis. The area of deformity is determined and the defect is corrected using a combination of incisions and excisions of the prepuce, foreskin. Care is taken to dissect around nerves and blood vessels. Sometimes the urethra is dissected free of its position and retracted temporarily away from the operative site. The separate tissues of the penis are closed in layers with absorbable suture material. An artificial erection may again be produced to test and demonstrate the adequacy of the repair. Plastic operation on penis for correction of chordee or for first-stage hypospadias repair with or without transplantation of prepuce and/or skin flaps. The physician also prepares the penis for correction of hypospadias, an abnormal opening of the urethra on the underside of the penis or on the perineum. During a later stage. Often the foreskin is used in a free graft or a flap graft to cover the ventral skin defects created to correct the chordee. The separate tissues of the penis are closed in layers with absorbable suture material. Plastic operation of penis for injury. The physician repairs an injury of the penis using one or more of plastic surgery techniques. The repair may require skin grafts, tissue grafts, urethral repair, extensive debridement, microsurgical repairs, or any combination. Plastic operation on penis to correct angulation. The physician corrects an abnormal curvature of the penis using a series of excisions of tissue on the side of the penis. To assist in planning the surgery, an erection may be artificially produced by placing a band around the base of the penis and injecting saline into the body of the penis. The area of deformity is determined and using a combination of incisions and excisions of tissue, the defect is corrected. An incision is made in the skin of the penis just proximal to the glans, head of the penis, and the skin is pulled to the base of the penis, exposing the underlying tissues. Further dissection is done to expose the thick connective tissue on one side of the shaft. A series of parallel excisions are made and the resulting defects are closed by suturing. The separate tissues and the skin of the penis are closed in a layered fashion with absorbable suture material. An erection may again be induced to test the adequacy of the repair. Plastic operation on penis for epispadias distal to external sphincter. The physician corrects epispadias, which is the congenital absence of the upper wall of the urethra. The urethra has its opening anywhere on the top surface of the penis. A closed urethra is created by reproximating the tissues, and by using skin grafts, tube grafts, free tissue grafts, or a combination of techniques depending on the extent of the defect. Plastic operation on penis for epispadias distal to external sphincter, with incontinence. The physician corrects epispadias and associated urinary incontinence in one or more stages. Epispadias with incontinence is the congenital absence of the upper wall of the urethra and the lack of function of the muscles that control the bladder neck. Through an incision in the lower abdomen, the surgeon reconstructs the bladder neck and reimplants the ureters from the kidneys away from the bladder neck outlet. A closed urethra is created by reproximating the tissues and by using skin grafts, tube grafts, free tissue grafts, or a combination of techniques depending on the extent of the defect. Plastic operation on penis for epispadias distal to external sphincter, with exstrophy of bladder. The physician corrects epispadias and exstrophy of the bladder in stages. Epispadias is the congenital absence of the upper wall of the urethra. Bladder exstrophy is the turning inside out of the bladder so that the bladder is open directly to the outside, and as such, urine does not collect in the bladder but simply drains without any control to the outside onto the lower abdomen. The first stage is to close the bladder through incisions in the lower abdomen. The surgeon frees the bladder from the abdominal wall and proceeds to close the bladder and reimplant the ureters from the kidneys away from the bladder neck outlet. In the second stage, a closed urethra is created by reproximating the tissues and by using skin grafts, tube grafts, free tissue grafts, or a combination of techniques depending on the extent of the defect. In the following stages, the physician reconstructs the bladder neck to provide urinary control and, if necessary, does additional surgery on the penis and urethra. Plastic repair of canaliculi. The lacrimal system serves to keep the conjunctiva and cornea moist through the production, distribution, and elimination of tears. Lacrimal canaliculi are the ducts that carry the tears from the lacrimal gland where they are produced to the nose. The physician uses a probe to locate the distal and proximal ends of the canaliculi in the injured eye of patient. The ends are freshened and reattached with sutures. The wound is closed with layered sutures. Plastic operation on urethral sphincter, vaginal approach, e.g., Kelly urethral plication. The physician accesses the urethral sphincter from the vagina. With a catheter in the urethra, the physician dissects the midline vaginal wall separating it from the bladder and the proximal urethra. Sutures are placed at the junction of the bladder and urethra on each side of the urethra. This supports the area. Excess vaginal tissue is excised and the vaginal wall is closed. Plastic repair of urethrocele. The physician repairs a urethrocele, which is a sagging or prolapse of the urethra through its opening or a bulging of the posterior wall of the urethra against the vaginal canal. The prolapsed urethral tissue is excised from the meatus in a circular manner. The cut edges of urethral mucosa and vaginal mucosa are sutured. Plastic repair of introitus. The physician repairs and restores the anatomy of the opening of the vagina by excising scar tissue and strengthening the supporting tissues using tissue flaps and suturing techniques. This procedure varies greatly from patient to patient, depending on the defect to be corrected.